to the Minding Her Business podcast. Today we're joined by Danielle, who works in private practice. She's a therapist in Michigan. Can you kind of tell us a little bit about that for those who may not know you or know what you do for work?
Yeah, well, first of all, thank you for having me.
Thank you for
coming. So excited for your new podcast, and I love the name. So I live in Windsor. And I'm a registered social worker in Windsor. I've been practicing for a little over 4 years now. And then I am a licensed master social worker in Michigan, but in private practice. So my master's is in social work, but with social work, there's so many different avenues that you can take, whether that's, doing government like policy stuff, or if you want to do one-on-one psychotherapy, if you want to be a professor, like there's just so many different avenues, working for CAS, CPS in the States. So I chose the psychotherapy route and decided to just expand in the States just because there's so much more opportunity. But yeah.
That's amazing. Okay, so what's the difference? Is there a difference between social work and therapy? Like being a therapist versus social worker? Yeah,
so social worker is just like kind of like the broad, like the foundation of it, right? Okay. So like at heart, like I'm a social worker, like that's what my master's is in, but you can specialize after. Okay. So like there's social workers who aren't therapists, who work at Children's Aid Society and, doing child protection services, but they can't call themselves therapists because they're not doing psychotherapy, right? And then there's, like I said, you can be a professor, and then there's people who do therapy on the side. So it's like a branch of social work, if that makes sense.
I love that.
Yeah.
So, and you're allowed to practice in Canada and the States?
Yeah, so after you're done school in Canada, you pay a huge fee and you're a social worker, right? Obviously get like a background check, they check your education. And then in the States, and particularly in Michigan, you have to get licensed in every state, and every state is different. But basically you have to work 4,000 hours under a supervisor, and then you have to write this massive 4-hour exam that's super hard, and it's like being in school all over again. So when I decided to work in the States, I had to start from basically ground zero and accumulate all my hours. And like when I was a social worker in Canada, like those hours didn't count. So it's different licensing structure over there, but yes, I still renew my license in Windsor. I'm not actively working in Windsor, but my main focus is Michigan private practice.
Amazing. Okay, so we'll just get right into it. So one of the really big questions I had for you, so for myself, I work for myself, I'm an entrepreneur, I don't have benefits except for the government, obviously benefits. So I would love to be in therapy, but I also can't afford, how expensive it is. So is there a way of getting around that and still getting like high quality or at least good quality services?
Yeah, and I get asked that question a lot. So I understand therapy is expensive. It is very expensive, the same way getting your hair done is very expensive. If you want a good hairdresser, you're going to pay top dollar, right? It's kind of the same thing with a good therapist who's experienced, right? And the reason why it's so expensive is because it's a hard job. We are not only listening to your traumas, we're also kind of taking it on, and we're also thinking 3 steps ahead of you on what to say, making sure you feel heard, giving you the appropriate response, making sure we're following the right treatment modalities and interventions. So with that being said, there are a couple of places in the GTA area, and I think in Windsor, but BetterHelp, I think they range anywhere from $40 to $70 a session. And the therapists I heard are very good. And then Psychology Today is where therapists can be accessed throughout all of North America. And you just kind of put in a filter of what you're looking for in therapy, and then check if that therapist offers a sliding scale. So I know for me, if someone is paying privately and they don't have insurance, if they're a student or a single mom or just someone who's struggling financially, I do offer a sliding scale for those individuals. So it's just accessing those tools on those websites, and a lot of people don't really know, but when you do that consultation with a therapist and you tell them your situation and ask them hey, do you offer a sliding scale, a lot of them usually do. So yeah, it's not too bad.
So you work in a private practice.
Yep.
So how does that work? Do you have to build your own clientele, or I'm not really 100% sure what the difference is. So can you kind of explain?
Yeah, of course. When I started, so basically I started right out of grad school. I had a couple of job offers, but it was in COVID. Okay. And I did my master's in the States. So one of my professors had a private practice and she was like, I really want you to come work for me. And I'm like, I don't know, I think to be in private practice, you kind of have to be experienced. It's because I also didn't know exactly what type of therapy I wanted to offer, what type of population. So I started working as a social worker in Canada for one of our hospitals in Windsor, and I focused in on children mental health. And I worked with kids, low-income families, did therapy with them and parents. So then I was like really burnt out after a year of doing it. I didn't really have any time off. And I was like, okay, you know what? I want to explore other opportunities and what it's like working in private practice, but in the States. So if you have really good insurance in the States, you can go to therapy every week, unlimited. Sometimes I see my patients twice a week. Wow. And it's covered by their insurance. Whereas in Canada, obviously, as you know, like some people have like $500 a year for a therapist or $1,000 a year, and that maybe gets you like 3 to 5 sessions if you're lucky, right? So when I first started, the business I was working at, they referred me some clients or patients, however, whichever you want to use. But after that, it's been word of mouth and Psychology Today, right? Yeah. So just advertising yourself, focusing on what you want to offer and the population you want to specialize in. So it took about maybe like 6 months for my caseload to get full. But yeah, and then after I discharge, it's depending on, where that individual's at, if they want, biweekly sessions, monthly sessions, and they're doing okay. And I'm like, okay, you know what, like contact me if you want some maintenance sessions in the future. And this will allow somebody else to kind of get on my caseload. Yeah. Right. So yeah, about 6 months to 8 months. It all depends how bad you want to work.
So you touched on this a little bit before, and I want to circle back to it. So you said, why you guys get paid so much? Is it so like you're taking that onto yourself? And I have thought about that. I mean, even when you're talking to a friend and like, you're taking on what they're saying and you feel really bad for them, I can only imagine what people are coming to you and having to listen to people's problems all the time, which you love to do it. It's your job and all that stuff, but I can only imagine it takes a toll on you. So like, how do you deal with that?
That's a good question. So I think my career has definitely changed me. I wouldn't say necessarily for the better. Yeah. When I first got into it, I had like this fire in me and I'm like, I'm going to help everybody in the world. And that changes over time. And you really have to establish boundaries and figure out who pours it back into your cup after work. Okay. So I used to be an extrovert prior to getting into my career. I loved talking to people all day long, would go out. I had no issues at night, like socializing after, school or even working before I got into my big girl job. Now I'm very selective with who I spend my time with. So after work, I do something that's extremely mundane. I watch a lot of reality TV. I'll make myself a nice dinner, or I'll go out with friends, and it's friends that add back into my cup. I have friends that don't necessarily take from my cup or pour back into my cup, and I kind of save spending time with them on the weekend when I'm fully recharged, relaxed. But I also see my own therapist about once or twice a month.
That was going to be my other question.
Yeah. And she's really cool. She only sees therapists. So she gets it, and she's kind of like a mentor in a way. I learn a lot from her. But yeah, it's definitely not easy, and it's very mentally straining. I love it, but I focus in on good sleep, and like exercise very much helps for me in order to recharge. And I have to recharge in order to give good quality therapy.
Absolutely.
Yeah.
So another question is, so you're listening to people's problems all the time, and I know there's client privilege, right? Do you ever like
confidentiality?
Yes. Yeah. Like if I hear something like some tea, I'm like, I want to share that with someone, and you can't. So you have to just hold it in, or do you ever like share the stories without the names?
That's a good question. I definitely, I don't talk a lot about my job. Yeah. even when I was dating my ex-boyfriend, we didn't want to talk about work when we were done work because you're just so drained. The only people I do ever talk about my cases, and I'm very general with it. I never give names because obviously it's confidential, right? It's with one of my best friends, and she's a therapist. Okay. So we'll kind of like bounce ideas back, you know, with each other, off of each other. But normally, you just
keep it in.
You just keep it in, and you do research on your own and figure out, okay, what's the best way I could help this person. Oh, wow. But I think once you are in the field for like a couple of years, you kind of become like nothing's really like tea. Like it's kind of just like everyone's got issues. Yeah. And I think that's the biggest thing that this career has taught me. Like no one is perfect, and we're so complex in our own ways.
I love that. I do. So we, when we talked a little bit before the podcast, we wanted to talk about medication too. Yes. So do you prescribe medication? No.
No. So basically how it works is it can be very confusing. So I have, like I said, I have my master's, and what I can do in the States is provide psychotherapy and provide diagnosis. Whereas if I refer out for prescription medication, which I always do, not always, I shouldn't say, I would probably like 80% of my caseload, I refer to a psychiatrist or a psychiatric nurse practitioner. So someone who specializes in psychotropic medication. Yeah. A lot of people will ask me questions on like, well, what do you think? Like, which antidepressant or anti-anxiety medication should I go on? And that's out of my scope of practice to be like, you should be on Prozac or you should be on Zoloft, right? I have a general understanding of psychotropic medication from working on a psychiatric floor and working with psychiatrists and also taking some classes in school, but I'm in no way, shape, or form to be like, yeah, you should try this medication. I can just give them kind of some psychoeducation on the medication and how it might benefit you, but to always go and have those questions ready for a general practitioner.
So I was on medication for a couple years. I was on an antidepressant and an anti-anxiety medication an
SSRI.
Yes, that's exactly what it was. Obviously, you know that. And so I loved it at first. I was going through a little bit of a tough time, and it numbed me, which was perfect for the time.
Yes.
And then, you know, you're kind of going through life, and I'm happier things are happening to me, and I'm like still like I'm not having those highs or those lows. I'm a very emotional person. I will cry literally at anything. It's a little crazy. And I remember I was watching a movie with my boyfriend, and we first started talking, and something sad happened, and he was like about ready to cry, and I was just watching, which is so not like me. And he was like, "Is this girl okay?" And then anyways, I got off the medication, and obviously now I cry at everything, which is good and bad, right? So kind of where I wanted to go with this is there's still times where I'm sad or, you know, I have a lot of anxiety, but I don't want to be on that medication because I like to feel most of my feelings.
Absolutely.
So, I mean, obviously therapy, like if anyone could be in my state, what would you kind of recommend?
Yeah, like what's the happy medium?
Yeah.
Totally. So first of all, there's nothing wrong with being highly sensitive, right? I think when people say like, oh, like I feel everything, like that's an amazing quality and gift to have. You're an empathetic person, right? You can feel, you're intuitive to other people's emotions, you feel things deeply, and there's people who don't have that quality. And, you know, sometimes I wish I can be like those people, but I also wouldn't be able to perform my job, right? So with that being said, I think, you know, when someone does try an SSRI and they're like, no, I feel numb, side effects, and they are just like totally giving up on it, I always suggest try something else. Go consult with your doctor, specifically a psychiatrist, because they specialize in those medications, and try something else. It's trial and error, right? Not one size fits all. But, you know, if you're going through something situationally, you know, SSRIs can kind of be like a Band-Aid in that situation. So that's why I'm like, therapy is very helpful. But also too, like, I'm not a naturopath doctor by any means. There are like holistic remedies, like 5-HTP is like really good for depression from what I've heard and just like research I've done. There's SAM E100, I think it's called, and that's supposed to help with mood and like increasing your mood. And then there's obviously things at night that you can take. Like I love magnesium citrate for like good sleep and just like a good quality one, right? Like people will go to Shoppers Drug Mart and buy like stuff that's been sitting on the shelves forever. So I'm like, go to a good quality source, like pay the extra money and you will get, you know, what you're paying for, like we talked about earlier. So there are other avenues, but I think obviously just not giving up when something doesn't work for you the first time.
So have you ever heard of ashwagandha?
Yes.
Do you know like anything like what you've heard about?
I've taken it before. To be honest, it didn't do much for me, right? So there's, it kind of just gives you like that calm effect. There's one that I like, I don't know if I'm saying it right, again, not a naturopath, L-theanine or L-theanine, I can't remember, but that really helps me to promote relaxation. A lot of people take it before they have their coffee to not get the coffee jitters. But yeah, that's also helpful. But I did want to say too, for anyone who's struggling, like I look at mental health on a spectrum, right? So anyone who's on the mild to medium end of the spectrum, like therapy is going to be very, very helpful. And same thing with herbal supplements. But anytime you're on the moderate to severe end of the spectrum, then that's where medications are a really good idea to explore, just because like no one wants to be living with chronic anxiety all day long. It's okay to have anxiety once or twice a week when, you know, you're studying for an exam or you have a job interview or, you know, just for any normal day-to-day things that make you nervous. Anxiety fuels us, right? But when you're waking up with like a constant like beating, like your heart's just like coming out of your chest and you're sweating and, you know, you're spiraling, like you need to to probably go talk to your doctor, because that's not a healthy way to live.
That's actually not... Yeah, I feel that. I feel
Yeah.
that a little bit.
So there's situational, like I said, and then there's like chronic every day. Same thing with like depression, right? No one wants to be in a really low mood where they can't get out of bed, function every day. Whereas like, okay, yeah, you can take herbal supplements, but like I would never tell someone and be like, you should go and exercise because you're feeling like really depressed. And it's like, no, maybe we should like try to get out of bed and brush our teeth. Right? And medication will help, and same thing with therapy. But like I said, the severe end of it is when, you know, you have to look at other options.
So I kind of want to talk about TikTok.
Yeah.
So myself, I mean, I've self-diagnosed myself with probably 20 different illnesses, and I'm probably terminally ill, as I'm sure all of us are. We feel like we are. So do you ever have people that come in and they're like pretty set on like, I have this, TikTok told me I have this, I know I have this, and they're not really open to hearing what you have to say? Or just how has TikTok influenced your work at all?
So I do love TikTok, but you have to be so careful with who you're listening to, right? And that's not just for mental health. It's like for nutrition. I'm sure you see people being like, go to the gym and, you know, you'll lose X amount of weight. And it's like, there's so many, it's so complex, right? So yes, it's easy to self-diagnose. I think I really like to say, and I think it's beautiful, we all have a little bit of everything. We all have a little bit of ADHD. We all might have a little bit of OCD, a little bit of anxiety, right? But in order to meet a full diagnosis and how it's diagnosed in North America and Western society, we go off of the DSM-5, and it stands for the Diagnostic Manual Statistics of Mental Health Disorders. And you have to meet a certain minimum of criteria to be diagnosed with something. So like, let's say for generalized anxiety disorder, you have to meet, I can't remember the top of my head, like 6 out of the 7 or 6 or 7 out of like the 10 of the symptoms within the last like 2-month period in order to be diagnosed with generalized anxiety disorder. So just because you're experiencing some symptoms of certain diagnoses doesn't mean you meet the full criteria for that diagnosis.
Absolutely. Okay. And do you find people come into the practice?
Oh, right. Yes, I need to answer that one. So usually like my young adults, older adults, they're pretty good. They're like, you know, I think I have this, and I'm like, everyone thinks that they have autism right now. And I'm just like, like, you know, so if I do notice some like autistic tendencies, I will refer to a psychologist, because they have the right tests and like measurements tools to be able to actually diagnose learning disabilities. Learning disabilities is just not my specialty. But the people that I have a really hard time with are parents, and they'll say that, yeah, my kid has oppositional defiant disorder, or my kid has ADHD, and it's like, ADHD, maybe, possibly, whereas oppositional defiant disorder, what that is like the child's very rebellious, very defiant, doesn't listen to authority. And 9 times out of 10, that's usually all parent work. So it's like, no, your child doesn't have ODD.
Yeah.
It's more so like just teaching your child discipline, labeling your child's emotions, validating your child, and giving them positive choices, right? Because it's a power struggle between children and parents. So that's usually who I have difficulties with the diagnosis, but eventually they're pretty on board after.
Yeah. So what's your most common diagnosis right now? And why do you think that is the most common one that you give out right now?
So I think, this is like even research wide, you can ask any clinician, anxiety and depression, and that's been a while. So there's a huge scarcity mindset with just social media, right? Like we're comparing ourselves constantly, and like who has the better life, and social media is so fake. Like
so fake.
It's, like everyone's presenting their best versions of themselves, right? I also think like we have access to media outlets 24/7. So like compared to when our parents were growing up, like, they probably all sat around the television in the evening, but like we want to know what's going on at 6 o'clock in the morning. We can scroll on TikTok or Twitter, whatever, to get that news. So like we're always in that constant fight, flight, or freeze, right? Which is making us anxious. Yeah. And obviously as a woman in our society, we're always watching our back, like, and that's what's making us super nervous. So I see that it's very prevalent in women, anxiety. Same thing with depression. Life is hard. It's not easy, right? And for anyone to say, like, I'm not into toxic positivity, but for someone to be like, oh, like, you have to think positive. And it's like, that's BS. Like someone who, doesn't have a good foundation, someone who grew up in a low income family and just don't have those tools and resources, like that's really hard to think positive.
Oh, 100%.
Right? The biggest thing that I see with men that they're coming to therapy for, and I love it, is just like them learning how to be available.
Oh, wow.
So that's not a diagnosis, obviously, but like a lot of men aren't in touch with their emotions, right? And that's how they were raised, obviously societal standards.
Is like such a big thing.
Exactly. So just teaching emotional intelligence to a lot of people, getting them to become self-aware, that's like one of the biggest things that I'm seeing right now.
That's incredible. Good for them for taking that leap.
I know, it makes me so happy, and I always like applaud them too, because I'm like, I know it's not easy coming to therapy, like such a stigma around it, especially for like, you got the jockey football guys like coming to therapy, and I'm just like, this is amazing. I'm so proud of you.
Have you seen some progress with them?
Oh my God. Absolutely. And it just betters themselves. It betters their relationships, like how they speak to like their partners, and just like how they speak to people in general, and like just teaching them how to be empathetic, because they know how to be sympathetic.
Yeah.
But it's like really just teaching them like how to feel and how to empathize for somebody else's situation.
Well, good for them. If they're listening, shout out to you guys.
Yeah,
good for you guys.
I know.
Specialize in trauma, anxiety, and depression, right? So what's your favorite treatment for those? Yeah,
so it's a great question. My favorite treatment ever, it's evidence-based. They don't teach you this in school, so after you become a therapist, you have to kind of go do some specializations if you want and find your niche. And I was like, okay, I'm gonna invest in this one training. It was super expensive. It's called EMDR, so it stands for Eye Movement Desensitization and Reprocessing Therapy. Prince Harry has done it, like lots of famous actors and actresses, Sandra Bullock, who else? There's like, it's on Grey's Anatomy, but basically, I could be here all day talking about it. It's really confusing to explain. It's not traditional talk therapy. Okay. So it's reprocessing old trauma that's been like staying in the body, right? So you can talk about something until you're blue in the face, especially with trauma, but when those signs of the traumatic incident, such as like maybe a smell or somewhere it reminds you of that traumatic incident, that's always going to stay with you. Whereas with this EMDR type of therapy, it will clear out those sensations in your body, and it allows you to develop healthier core beliefs about yourself, about the world, about others, and you just very much become desensitized to that trauma.
So I know this is probably not what you're talking about, but when you're, and I've seen this on TV, where like someone's laying down, their eyes are closed, and you're making them like relive.
That's
like,
hypnosis.
Oh,
yeah.
Not the same thing.
No, that's okay. And hypnosis, I think it's cool. I don't know too much about it. I don't know if it's evidence-based. So like that's the thing, right? And evidence-based is like there's lots of studies. They've done it on war veterans. So I was like, if I'm gonna be spending like a couple grand on a training, I want to make sure there's some evidence there. There's research, and it's been around since the 1980s, and it's life-changing. Like I've had it done, and I thought like I was over something, and then my mentor like did it on me, and like all of these emotions came out, and like they were just stuck in my body, right? So it's absolutely, it's life-changing, and you don't need like 10 sessions. You could, heal from specific traumas within like 4 to 6 sessions.
So is this something that someone would book with you specifically? Like, hey, I'm coming for this specific type of therapy?
Yeah.
Oh, okay.
Yeah, so I have people who I see them twice a week. Once in the beginning of the week, they'll do a talk therapy session. They want to tell me about their week, things that are going on in their life, and maybe just some anxieties that they're dealing with. And then on a Thursday or Friday, we'll do an EMDR session. So we will focus in on their past trauma that's manifesting in their current day-to-day life and relationships. Because if you're doing trauma talk therapy, like I'm sure that works great, but you're going to be in therapy for a very long time.
Yeah. Do you find like one or the other is more heavily taxing on you? Mentally?
Talk therapy.
Talk therapy? Yeah.
Whereas EMDR therapy, it's really funny, but it's bilateral stimulation. So basically, I'll have you tell me about a time that was really traumatic to you, and I will have you kind of bring up the emotions, body sensations that come up as well, and I'll have you follow a light.
Really?
Yeah, so I have you follow a light, and basically your eyes go from emotional brain to logic brain, and it's clearing out that trauma. So so I'm not talking the whole session, but however, I am attuning myself to the individual. So if the individual starts crying and they're telling me, they're bringing up things that they forgot, that they have very much like repressed, it's hard work, and I have to be careful, check my emotions, right? So some of the stuff is really like damaging, that the things that have been done to these individuals. So it's hard, but I would say, talk therapy is a little bit more mentally straining.
Have you ever cried during a session?
Almost one time, and I really had to hold, is when I first got into private practice, and it was a really beautiful session. It was a father and a daughter, and the father was, he's dealing with a lot of substance abuse, and they had this amazing relationship before, and I was seeing the daughter as a patient, and her dad came in, and he was going through AA recovery, and they were strengthening their relationship again, and it was just, I have an amazing relationship with my dad, so I was just like, it was just so sweet to see, and they like hugged at the end, and like he apologized to her, and it was like so touching, and I was just like, okay, these are like little sessions like this are basically what reinforce like why I got into this career, because sometimes you like I struggle with imposter syndrome, and I think everyone does. So I was just like, okay, like I'm doing okay work. This is good. So
you definitely are.
But no, I try my best, just because I don't ever want to make it about me. Someone's paying for the full 55 minutes, and it's specifically about them.
So is it not like there's rules or anything, but like it's kind of a big no-no for therapists?
Yeah, I mean, like there's nothing wrong with it.
Yeah.
But if, I start crying in the session, I don't want the individual to be like, are you okay?
Yeah, no,
you know what I mean?
sense.
It's like, no, like this isn't about me. Yes, that was hard. And there are times where I, like after someone has left, I close the door and I'm like, oh my God. And like I'll like call my best friend, the therapist, and be like, man, like I gotta talk to you after, like we gotta talk about this, like, and it stays with you for sure, but you kind of just shut it off for the next session.
Yeah, do you have back-to-back-to-back sessions?
Yeah.
Is it kind of hard, like going in between?
That's how I like to do it. So I usually see, there's clinicians that only see like 4 a day.
Yeah.
I do 6 a day.
Okay.
And I will do back-to-back. It's just easier for me, because I find that when I take like a 2-hour, I don't want to go back to work.
Yeah.
That
makes sense.
So I have like a 10-minute break. So I'll like go to the bathroom, shove something down my throat, drink as much water. And then, when I'm done for the day, I'll do all my case notes, documentation. But no, it doesn't work for me. But it's all based on the therapist.
Absolutely. Mm-hmm. So for someone that could be, deciding between therapy or medication or both, mm-hmm. like what would you recommend for them, or how could they kind of figure out what you think would be best for them?
So it's all based on the individual, right? Yeah. For someone like you, you're not hearing voices every day. Yeah. You're not having super low lows. You're not having super high highs. I think, just recognizing what your patterns are. Mm-hmm. So like if you're noticing that you're super stressed out, or you're not happy in your relationship, or, you continue to do things like you struggle with time management, I think searching for a therapist that you like, shop around for one. That's the biggest thing, because therapeutic rapport and alliance is the biggest thing. No matter how smart that individual is, it's really based upon how good of a rapport and how warm and welcomed you feel with that therapist, right? And then you can talk about the options of like medications with your therapist, if they can refer you to a psychiatrist or a doctor who specializes in medication. Now, for someone who is on the severe end of, mental disorders such as schizophrenia, for example, or mood disorders, someone who's manic or is really just like in crisis, then I think obviously going to a psychiatrist first for them to do a full assessment, because it's a chemical imbalance, right? A therapist can't fix if you're producing too much serotonin in your brain, right? So it's all based on the individual.
So mental health is, such a personal and vulnerable topic. Do you find that clients ever come in and they have their walls up and they don't want to talk or open up to you? Or do you find a lot of them are coming to you ready to work on themselves?
So I've had maybe 2 people that are super guarded, and I'm working so much harder than them. And I have to remind myself, like, the therapist should never work harder than the patient, right? And they're usually teenagers that are like, I don't want to be here. My mom just thinks I'm crazy, yada, yada. So basically the first 4 to 6 sessions, when this is what's nice in the United States, when you have good health care, you have like unlimited therapy for the year, right? I will just use those sessions to get to know each other and at rapport building, right? I never talk about someone's trauma the first session. Like if someone's like, I want to talk about this that happened to me when I was 5, and it's like sexual abuse or any type of trauma, right? I'm like, okay, like, thank you so much for sharing that with me, and I would love to explore that maybe like after you start to trust me a little bit. But like let's kind of keep it light and focus in on maybe the questions you have for me, and like really just some what's the word, icebreakers, just to get to know that individual. But for the most part, no, like people come to therapy and they're like, I want to work on this and I want to get better. And I think a lot of the times they do feel heard. And I really make sure that even though I'm a therapist, I tell them, like, I leave my ego at the door. This is a judgment-free space. And I've heard of everything you can think of. I've had experience working, with all variety of different populations. So nothing really is going to scare me. And I think, after I say that, they're just like, okay, like this is a safe space to kind of talk about the things that I want to talk about.
Good for you. I love that.
Yeah. It takes time to learn though.
Yeah.
It's scary at first. I don't know what I was doing. Like you have to I was just like, I don't know what I'm doing, but this is like, it's really just knowledge is power and time. Giving yourself time and figuring out what works best for you and what works best for, your clients.
So what's your take on overlapping diagnoses where, clients might be navigating multiple conditions affecting their mental health?
So I do have some people who come in and they're like, I have anxiety and bipolar disorder and PTSD. So I'll say to them like, okay, bipolar disorder, again, you got to be really careful and make sure that you are on the right medication for that, right? Because there's a lot of risks if you're in a manic state or if you're in a really depressive state. So I'll always make sure like, okay, are you on the right medication? I'll consult with their doctor if they sign a release of information form and make sure that their mood's managed. Now I'll be like, okay, so with your anxiety, this could be a side effect of your trauma, right? So it's from a trauma lens, I think anxiety, depression, borderline personality disorder, that is all caused, a lot of it is all caused by trauma or genetics, right? So I'll ask them, what do you want to work on first? What's the most severe thing that's impacting your life? Is it your anxiety? Like, do you feel like your anxiety is debilitating and like you can't get any schoolwork done or you can't perform properly at work? So we'll, focus in on some talk therapy. It's called cognitive behavioral therapy. And they just start to become more aware of their thought process and how it's impacting their feelings and their whole behaviors, getting them to recognize their patterns, giving them like really good coping strategies. And then I'll be like, okay, do you want to dive into your trauma and see, what core beliefs that you have that are very much contributing to how you view yourself, how you view others, and how you view the world.
So what do you wish that more people understood about therapy?
It's not a one size fits all, and it's a collaborative process. And if you go to therapy maybe 5 times, awesome, but you're not going to be fully healed in 5 sessions. Growth is amazing, and healing's not linear, right? So there might be days where you're like, wow, I'm doing really good, therapy's helping. And then there's other days where you're like, oh my God, I feel like I took 3 steps back. That's okay. That doesn't mean that, you have reverted like that process, right? So, and I think just noticing your patterns, and this is where self-awareness comes into play, like recognizing like, okay, is it up to me to do the work if, I'm struggling with X, Y, Z? And it is, right? So shopping around for someone who specializes in the things that you're struggling with.
So lastly, if someone's thinking about going into therapy, but, they're a little nervous or they don't really know where to start, what would you say their first step is?
Research. And I think just like even going on Reddit, I love Reddit, even like TikTok, just checking in to see what therapy is about, right? And there's such a stigma behind it. I think it's getting a lot better with this generation. Gen Zs love therapy. So I think, it's just recognizing that it's not just talking about your feelings the whole time. It's about growth and figuring out why you do the things that you do and your attachment styles, how you might depend on your partner, why, you know what I mean? So it's just, I think, asking yourself if you want to evolve and grow.
That's a really good answer. Is there anything before we move into our special segment that you would like to cover that we didn't cover?
No, I think we're good.
Okay,
yeah.
Perfect. Okay, so I made this fun little segment. We do this with everyone, but it's different for everyone. So these are, obviously, you're only going to be able to give very general disease.
Okay.
But it's just something that, ChatGPT wrote out for us.
Oh, gosh. Okay.
And it's something that someone could be, some of them are a little silly, some of them are whatever. And again, this is not a diagnosis for anyone. If you are going through these things, this is just a fun little lighthearted game.
Okay. Sounds good. You're like testing me right now.
Okay. So I get super anxious if I send a text and don't get a reply within 5 minutes. My brain goes into overdrive coming up with the worst case scenarios.
So it sounds like you have an anxious attachment.
Okay.
So that's not a diagnosis.
Yeah.
But basically an anxious attachment is, so I'm not going to get into attachment theory, but we have secure, which means like if you sent the text, you don't care if someone responds back 5 minutes or 5 hours. You're like, they'll answer me. And if they don't, like, oh, well, it's fine, like, I'll be okay, and you won't struggle with those, like, sensations. But yeah, that's not you're just struggling with anxiety, right? But that sounds like more of an anxious attachment.
Okay, love that. Perfect answer. So every time I see a typo in my notes, I feel like I can't move on until I fix it, even if it's 2 a.m.
So it sounds like rigid tendencies. Ooh. So rigid tendencies, again, not a diagnosis, but that would be like a criteria for OCD or anxiety.
Yep.
Or anxiety.
Love it. This is so fun. I'm having fun. Okay. I rehearse conversations in my head before phone calls, but when it comes to talk, I completely freeze.
Anxiety.
Yeah. Okay. Perfect. I overthink every small decision, like which cereal to buy, because I'm worried I'll regret it later.
Also anxiety.
Okay.
And like low self-esteem too. You're so indecisive. You can't figure out, what you're like constantly spiraling. I have a lot of people who struggle with that.
This one, I've heard a lot of people do this one with hair straighteners or curlers. I'm convinced my house will burn down if I leave without triple checking the stove, even though I haven't used it
I have a crazy story about that. So basically, this happened like 10 years ago, and I didn't realize like I was struggling with anxiety at the time. I forgot if I left my straightener on at home, and it was Christmas Eve, and I remember like just having a breakdown at dinner, and I'm like, Dad, like I don't know if I shut the straightener off, like what if the house blows up? And I was catastrophizing.
Yeah.
He's like, do you want me to go back home and check it? And like we lived like 20 minutes away from my grandmother's house, so he was like, I'll go back home. Anyways, he checks it. But yeah, that is a big one for a lot of people, and what I recommend is a behavior checklist. So like if you notice that like you have to make sure the door's locked, the stove's off, straightener's off, like either take pictures of it or check it off in your phone, put it in your notes app. Yeah, so that when you're thinking about it on your drive, you can just go back to your phone and be like, okay, I'm not crazy. I already checked this. It's good. But those are checking behaviors, which is a part of OCD.
I've heard people taking photos. That's a really good one. Okay, every time I do this one. Every time I walk into my room, I forget why I'm there. Then I spend the next 5 minutes stressing about whether it means I'm losing my mind.
That's a good one. I experience that sometimes. I wouldn't say it's a diagnosis, but I would say I would be leaning more towards ADHD for that one.
Yeah?
Yeah, inattentiveness. Also, too, like dissociation. Again, I would need more context with that.
Yeah, these ones are all very general, very, very general. I can't start working until my desk is completely organized, but as soon as I start, it's chaos again, and the cycle repeats.
Say that again, sorry?
I can't start working until my desk is completely organized, but as soon as I start, it's chaos again, and then the cycle repeats.
So, like OCD anxiety, again, with the rigid tendencies. So rigid means like, it has to be this way, or, you know, or I can't perform X, Y, Z. So like I would work with like learning how to think flexibly and like thinking like having other alternatives. But yeah, someone who's very rigid would struggle with that.
Well, that's all I have for you. Thank you so much for coming on to the podcast. It was a pleasure.
Thanks for having me. I
learned so much about myself.
Good.
Awesome.
You're not, everybody has a little bit of everything, so don't think you're terminally ill. And mental health is just as important as physical health.
Yeah.
So like no one's like scrutinizing you if like you have diabetes or like, you know what I mean, if like you have the flu. So like you have to look at it like that.
I think that, that's so important too. And we're all like so quick to spend, you know, the money on a gym, but then it comes to therapy and we're like, okay, well, it's so expensive.
Yeah, it's an investment. So, and I think anything you're investing in yourself is worth the money.
Exactly. Okay. Thank you so
much.
No
problem.
And until our next guest, thank you for listening and watching Minding Her Business, and we'll see you later. Bye.